Welcome to the Omni Dental Podcast.
And thanks for joining us for the deep dive.
Yeah, this is where we take the sources you provide, maybe articles, notes, whatever you're looking at, and we dig into them together.
We try to pull out the key info, the stuff that really matters, to help you get up to speed quickly.
Think of us as your guides through the material. So today, you've given us some info focused on dental implants.
That's right.
And specifically, you're interested in, well, how you might help them heal faster.
Mm-hmm.
The material is actually from Omni Dental of Arlington Heights.
It is. We've got a couple of things here from their website. First, their About Us page gives us a feel for who they are.
Okay.
And second, a blog post called How Can I Make My Dental Implant Heal Faster? Which seems right on target.
Perfect.
Mm-hmm.
So our mission today is to comb through these, pull out the main points, the practical tips, especially on how you can support that healing process after implant surgery.
Exactly. Finding out what you, the patient, can actually do to help things along.
All right, let's dive into these sources from Omni Dental of Arlington Heights.
Sounds good.
So first up, maybe just a little context on the source itself. Omni Dental.
Yeah, good idea. So they're based in Arlington Heights, Illinois. The address is right there, 305E Rand Road.
Okay, local practice.
Definitely. And the About Us mentions they serve nearby areas too. Buffalo Grove, Palatine, Mount Prospect, Rolling Meadows. Quite a few communities around there.
So established in that region.
Seems like it.
Hmm?
And it mentions Dr. Bylas Poles, DDS, leads the practice, highlights his experience over a decade.
Okay.
And his focus seems pretty broad. General, cosmetic, preventative dentistry, but also, importantly for this topic, handling things like dental injuries and emergencies. Comprehensive care is the term they use.
Got it. And what about their sort of philosophy?
They talk a lot about putting the patient first. Things like building trust, using their expertise, but also focusing on personalized attention, comfort.
Comfort's important with dental work.
Absolutely. They mention using advanced technology too and having a family-centered approach. It paints a picture of, a modern practice focused on the patient experience.
And they list a phone number.
Yep, 847-483-8833.
Okay.
And I think knowing this background is helpful. It suggests the advice we're about to look at comes from experienced local providers who seem invested in patient well-being and using up-to-date methods.
Right. It gives context to their recommendations on healing. It's not just generic advice floating out there.
Exactly. It kind of grounds the practical tips we're about to get into.
Which brings us nicely to that second source, the blog post. How can I make my dental implant heal faster? This seems to be the core of what you wanted to explore.
Yeah, this gets right to the heart of it.
Okay, so the article starts by mentioning the typical healing time, right?
It does. It states the usual time frame is somewhere in the range of 3 to 6 months.
Which is, that's for the bone to actually fuse with the implant, osseointegration.
Precisely. That's the biological process that needs to happen for the implant to be stable.
But the article suggests it's not just about waiting.
That's the key takeaway here, I think. While 3 to 6 months is sort of the biological baseline, the source really emphasizes that you can take proactive steps. It's not entirely passive.
So you can influence it. Maybe not drastically shorten it, but help it go smoothly.
Exactly. Help it potentially move along efficiently and, maybe more critically, avoid setbacks or complications that could slow things down. It's about supporting the process.
Okay, so actively helping nature, in a way.
You could put it that way. And the absolute number one most crucial thing they stress right at the start.
Let me guess. Follow the dentist's instructions.
You got it. Follow your specific dentist's or oral surgeon's post-op instructions exactly. They tailor those to your specific case, your health, the details of the surgery. That's paramount.
Non-negotiable baseline. Okay, so assuming you're doing that, what are the other actionable tips from this source? What's first?
The first big one is rest. Seems basic, right?
Yeah, rest is always good after surgery.
But the why is important. Your body has undergone trauma, essentially. It needs energy and resources focused squarely on healing. Rest lets that happen.
And what kind of rest? Just taking it easy.
Yeah, but they specifically warn against intense physical activity.
Ah, okay. Like hitting the gym the next day.
Definitely not. Pushing yourself too hard, especially early on, can cause more pain, more swelling, maybe even bleeding at the site.
Which sounds like it would definitely not speed up healing.
Quite the opposite. It can prolong recovery. They even mention being careful about, activities where you might accidentally get bumped in the face. Just common sense caution.
Makes sense. Protect the area, let the body work. What's next?
Eating soft and nutritious food. This is especially vital right after the surgery.
Why soft foods? Seems obvious, but what's the reason they give?
It's about avoiding irritation or damage. Hard, crunchy, or really chewy foods can physically disturb the healing tissues around the implant.
Okay. And do they give examples of good soft foods?
They do, yeah. Useful list: mashed potatoes, scrambled eggs, soups, pudding, oatmeal, mac and cheese, cottage cheese, soft-cooked veggies, things like that.
So things that don't require a lot of force to eat.
Exactly. And they also list what to avoid, like crunchy, raw vegetables or fruits, steak, nuts, basically anything tough or hard.
Got it. And they mention nutritious too.
Right. It's not just about the texture. A good diet, high in protein, vitamins, minerals, that gives your body the actual building blocks it needs for tissue repair and that all-important bone integration.
So it's a two-parter. Protect the site mechanically and fuel the healing biologically.
Precisely. Okay, next up, stay hydrated.
Water, water, water.
Pretty much. Proper hydration helps your whole body function better during recovery. The source says it helps flush out toxins, keeps your energy levels up, just generally supports the healing environment.
And what should you avoid drinking?
Water is definitely the go-to. They specifically say to avoid caffeine and alcohol.
Because they dehydrate.
Yeah, exactly. And alcohol gets a special mention. They say it can actually interfere with the healing process itself. The recommendation is to avoid it for at least 2 weeks after surgery.
2 weeks minimum. Okay.
Ideally, they say, until you're fully recovered. Dehydration itself can cause issues too, according to the source, like dry mouth, feeling tired, headaches, even constipation. Things you just don't need when you're trying to recover.
Right, makes the whole experience worse.
Yeah.
Okay, this next one sounds like a big one for healing.
It really is. Quit smoking. The source is very direct about this.
How bad is it for implant healing?
They call it one of the worst things you can do. The main reason is that smoking reduces blood flow significantly.
And less blood flow means less healing power getting to the implant site.
Exactly that. Less oxygen, fewer of the cells needed for repair, fewer nutrients reaching the area where the bone needs to fuse with the implant. It directly slows everything down.
It increases risks too.
Big time. The source links smoking to a higher risk of infection and, crucially, a higher risk of the implant actually failing to integrate. It's such a major factor that they recommend quitting at least 2 weeks before the surgery, if you can, to give your body a head start.
It really emphasizes the impacts.
It does. And they acknowledge it's tough, suggesting you get help from your doctor or dentist if needed. Shows how seriously they take it.
Okay. What about managing the immediate aftermath? Pain, swelling.
They recommend using ice packs. Simple but effective for those common post-op issues.
How do they say to use them?
Apply the pack to the outside of your face, near the surgery area. Do it for about 20 minutes at a time.
On and off.
Yeah, 20 minutes on, then take a break. Repeat that several times a day for the first few days. And they mention you can use this along with any over-the-counter pain relievers your dentist okayed.
Okay, straightforward pain and swelling management. What about keeping the actual site clean without scrubbing it?
Good question. That's where rinsing with salt water comes in.
The classic saltwater rinse.
Yep.
The source recommends it because it helps decrease bacteria in your mouth, but it's gentle. It doesn't irritate the healing tissues like some, harsh mouthwashes might right after surgery. Plus, it can feel soothing.
Do they give the recipe?
They do. Simple mix. 1 teaspoon of salt dissolved in about 8 ounces of warm water.
And how do you use it?
Just gently swish it around your mouth for maybe 30 seconds, then spit it out carefully. Don't rinse aggressively.
How often?
Up to 4 times a day is what they suggest, but always check your dentist's specific advice. It's just a gentle way to cleanse and soothe.
Okay. And the last main tip.
Maintain good oral hygiene. This is always important, obviously, but they stress it's especially critical during recovery.
So keep brushing and flossing.
The basics, yes. Brush twice a day, floss once a day.
Yeah.
But there's a little nuance here.
Oh.
They mention you might need a special toothbrush, maybe one with softer bristles, to be really gentle around the surgical area.
Yeah.
They say to ask your dentist about that.
Makes sense. Don't want to aggravate the site while trying to clean it. Exactly. And this ties back to the soft food advice too, right? Avoiding hard, crunchy stuff makes it less likely that food particles get jammed in or near the site, making your gentle cleaning more effective.
That's a really solid list of practical things. It puts a lot of the control back in the patient's hands, doesn't it?
It really does. It highlights how much you can actively participate in your own healing. These aren't like complex medical procedures. They're fundamental self-care steps that the source connects directly to better outcomes.
And just to circle back, this advice is coming from Omni Dental.
Correct. The practice in Arlington Heights that we talked about earlier?
And they actually do dental implants as part of their services.
Yes, it was listed in their About Us. So the people providing the advice are also people who perform the procedure and handle the follow-up care. It connects.
Right. And that contact number again was 847-483-8833 for Omni Dental in Arlington Heights, if folks in that area are interested.
Correct.
So boring it all down,
Mhm.
what's the main message for someone facing implant recovery?
I think the core message is, yes, healing takes time. That 3 to 6 month window is real for the bone integration. But you're not just a passive bystander.
Right.
By consciously focusing on these steps, proper rest, the right diet, staying hydrated, definitely avoiding smoking, using simple aids like ice and salt water, and being meticulous but gentle with hygiene, you are actively supporting your body's healing process. Based on this Omni dental source, these actions contribute significantly to a smoother recovery, potentially helping things stay on track and maybe even feel faster because you're avoiding problems.
It's empowering, really. Simple actions, big potential impact.
It is. These straightforward steps taken together seem to really matter for something as biologically complex as osseointegration. It highlights the value of that focused, patient-driven care during recovery.
It makes you think, considering how amazing it is that bone can fuse to titanium in the first place.
Yeah.
Isn't it remarkable that things like drinking enough water or eating soft foods play such a vital role?
It really is, that interplay between complex biology and basic self-care.
Makes you wonder, what other areas of our health could benefit from that same kind of focused, fundamental support that we sometimes overlook?
That's a great question to ponder. Very interesting thought.
Well, thanks for digging through these sources with me today. Really helpful stuff.
My pleasure. Good information there.
And thank you for sharing your material and joining us for this deep dive. We hope exploring this info from Omni Dental of Arlington Heights helps you feel more prepared and proactive about supporting dental implant healing.